So I'll kick off the wee introductions while hopefully everyone else is joining. As I say, if you haven't responded to the poll, please do just pop that a wee answer to that, and then that should clear off your screen. And as I say, we will close it just in a few moments once we get going. So I've just realised as well, I haven't actually introduced myself, big surprise there. So I'm Stephanie Stewart, I'm the Senior Improvement Advisor supporting the MAT standards within HIS. And thank you again, as I say, for coming along today. I'll just take you through some sort of general housekeeping for the session. So just in order to try and improve the quality of the call, we do ask that every one of our sort of speakers can mute their microphone and switch their camera. It just helps to sort of boost that call quality. But as you can see, we'll be using the chat function today. So please do engage with that, ask any questions or place any comments in there. And after each of our speakers today, we will also be timed to sort of pose any quick questions to them in terms of any content or that they've shared. If for any reason we run out of a bit of time, we will produce a written Q&A document that we can circulate after the event. And if you do experience any kind of technical difficulties during the call, please email us at his.mat@nhs.scot. And also sometimes just leaving and rejoining can resolve a lot of problems as well. Just as a bit of a kind of note in terms of context, we recognise that we do work in a kind of very emotive context, and there may be content that's shared today that might sort of that includes accounts of personal experiences across alcohol and drugs, which may be triggering. So it is important, obviously, that we look after ourselves and our colleagues. So if at any point you feel you do need a break, please do feel free to do so. The session is recorded, so like that you can catch up on it laterally as well. And again, once that recording is available, it will be distributed to yourselves, and you can share that with your networks also. As I said, there's a poll up at the moment, so please do take your time just to respond to that. It would really be appreciated, just so we can get a bit of an overview about what everyone's interested in and sort of where they're coming from. So in terms of the agenda for today, we're starting with a presentation from Gavin Smith from Fife Council, who's going to come along and speak to us about the housing and homelessness context and rapid rehousing transition plans and working collaboratively with ADPs. As I said, there'll be time following this for any Q&As or just to even share some general thoughts or reflections on what you've heard. Our second speaker today is Anthony Morrow from Sanctuary Scotland, who's going to share what they're doing with community connectors in housing and the impact this is having, and also how it links to the MAT standards. Following this presentation, again, there'll be time for a few questions and comments, and then we'll take a short refreshment break, which we aim to do at 10 to 12 for 10 minutes. So providing we keep to time, I will try my best to protect that time for you as best as possible. Our last speakers then of the day, following the break, are Cheryl Neill from Places for People, Carmen McShane from Turning Point Scotland, and Martin Wood from Police Scotland. And they're going to talk about kind of alternative approaches to supporting those with addiction in their tenancies. And then that will again be followed by a sort of short period of time for some Q&A. As I said, during any of the presentations at this morning, please feel free to put any questions or comments in the chat, and there's people monitoring that for us. So without further ado, so as to make sure my timekeeping behaves itself, I'll welcome our first speaker of today, which is Gavin from Fife Council. And so I'll hand that over to him. Gavin, if you just tell Kyle to move on slides as and when you want to, he'll be able to do that. And like to that, please do engage with the chat as well if you want to ask any questions of Gavin at the end. Thank you.
Yeah, hi Steph, I'll just maybe look to you, just check that you can hear okay. It's coming through. Perfect. Okay, thank you. And apologies to anybody who's coming along who might have been expecting my boss, John Mills. He's not available today, so he did ask me to stand in and fill the brief. For me, speaking in 15 minutes on such a broad subject is going to be a challenge, but I will do my best to keep it concise and leave some space for questions and answers. Just move on, please. So the kind of first part I was asked to do was just to set some context. This is a slide I really like from the Scottish Government. It's contained in a high level national action plan, and I think it probably summarises everything that we should be doing, and I do emphasise should, because I think we are a little bit off track in terms of the National Action Plan at the moment. So you might be aware that the Homeless Prevention Strategy Group set up a few task and finish groups around temporary accommodation, around prevention. The one I was involved with was measuring, are we really making a difference? I co-chaired that with Maggie Ranges. And there's one that will be of particular interest that isn't published yet around accommodation with support options that is due to be published fairly soon. So I think we are fairly lucky in Scotland that we do have a kind of fairly clearly stated aim in terms of a national action plan. It's mirrored by some fairly strong long-term housing strategy in terms of housing to 2040. But I think there are a number of things that we'll go through over the course of this morning that are maybe roadblocks in the way, and particularly challenging in terms of how we achieve joint working across these areas. My credibility is that I am a service manager with Fife Council, but I'm also the chair of the Chartered Institute of Housing in Scotland. I raise that because the Chartered Institute of Housing in Scotland and Fife Council recently produced a whole series of reports on rapid rehousing. So what I'm going to talk about today isn't just only my perspective. There is some bits that I'm going to feed on from that research, which give you hopefully a bit more national than just Fife. We need to be clear in all the stuff that we're talking about today. I think all 32 areas are a different place in terms of homelessness and housing at the moment. Moving on to the next slide. I've just talked about rapid rehousing. I've made a massive assumption that the 119 people joining this call know what rapid rehousing is. If you don't, the rapid rehousing journey started probably formally back in 2018 when local authorities were asked, not required to, but were asked with a specific guidance framework kind of shown there from Indigo House to develop rapid rehousing transition plans to show how a legislative environment around homelessness in 2012, where the last major change in legislation happened, the abolition of priority need, could move the agenda forward. All 32 did, mostly within the time frame set, but some kind of stragglers, but all made a commitment to sign up to what rapid rehousing actually meant in essence, and I've put the essence there. I should be clear also that not all people with drug and alcohol problems are homelessness. Likewise, not all people that are homeless have drug and alcohol problems. I'm very clear about that, but I was asked to focus on rapid rehousing, and that's where we will kind of set the scene around. What that was recognising was that significant progress had been made in tackling homelessness. There was a lot still in the statute books from the Homelessness Act in 2003 that hadn't been enacted. And there was a lot of a kind of legislative programme that the kind of former minister, Kevin Stewart, was really keen to see happening. So at the same time, local authorities were asked to develop local rapid rehousing transition plans. There was a lot of change going through around intentionality, local connection, temporary accommodation standards. It's been an absolute torrent of legislative and regulatory environmental change throughout the last kind of 4 to 5 years. Just to be clear, the rapid rehousing first part of that journey finished at the end of last year. It was a 5-year funded journey, and where the CIH got to was saying, well, there's a lot of things happening, there's a lot of good progress being made, but we need a longer term kind of horizon on this to help with where local authorities and their partners need to go next, and that didn't happen. We've got a 1-year extension on rapid rehousing at the moment, and other things that are happening there. So, when we wrote the rapid rehousing transition plans, I don't think anybody, that was I came into post and it was one of the first things I had to do was write Fife's rapid rehousing transition plan. I don't think anybody could have seen what was coming next, and that is in the next slide. So I don't think anybody saw a pandemic coming. I don't think anybody saw a war in Ukraine. I don't think anybody envisaged a cost of living crisis and manifested in quite the way that it did. And all the other things that have happened to lead the regulator, our regulator, Scottish Housing Regulator, to conclude in February and then strengthen over the course of last year that there are a number of systemic issues and challenges that local authorities are really finding it really difficult to grapple with. If you follow the industry press, the homelessness monitors talking about homelessness increasing by around a third over the next two years. There's no reason to suspect that. I don't think there's any diminishing the factors driving homelessness. It's poverty, it's societal issues such as domestic abuse, it's systemic issues around the operation of the housing market in its general terms. I'm not just talking about the social rented sector, I'm talking about the private rented sector as well. Local authorities and RSLs have got real challenges. We'll hear maybe a bit more about that over the course of this morning, but some real difficult decisions about building new, retrofitting old, improving the quality of stock, a whole investment problem that's out there, and that's an investment problem that was compounded in this year's budget with the significant cut to the affordable housing programme in Scotland, and in each local area, so equivalent to 26%, 27% in Fife, cut to affordable housing programme and its related budgets. Couple that with the pressures on keeping rents affordable and all the rest of it, landlords have got some significant financial and wider challenges at the moment. Moving on, you can now start to see, and this I've been really remiss, I put up a picture that doesn't include all housing organisation or local authorities that have that have declared housing emergency. It's missing Fife. My authority did on the 21st of March declare formally and politically a housing emergency. I thought the reason for saying that was probably around the basis in Fife was really about that threat to supply that I've just talked about. I can't meet my homelessness statutory duties at the moment. I'm breaching them every day. At the moment, as I joined this call, we don't have any temporary accommodation available to the local authority this morning, and that's been a pretty consistent message since Christmas time. We do know we've got a lot to do, as it is a housing emergency. It's not a homelessness emergency. Got a lot to do in terms of dampness, mold, condensation, and other things that are out there. Just now, RAC, condition of properties, there's a whole range of questions that are priority. Every budget's a priority, but where do you put that? I think the main thing that drove our members was really that dysfunctional housing system. People not able to exercise choices if they can't get into social rented sector, if they can't get their support needs met there. Options in the private rented sector are very, very limited. In Fife last week, there was 22 private sector properties available. That was all. It's a very, very limited market. So Fife certainly took the decision that we would declare a housing emergency, really about underlining our ability and capacity to provide support to vulnerable people, which is relevant to the subject you're talking about today. Each authority, Edinburgh, Glasgow, Argyll and Bute, that have declared emergency have had different reasons. Glasgow's is probably around asylum pressures and various other things, homelessness and others. Edinburgh's is just generally the market, and Argyll and Bute had a particular issue around supply in those areas, but that's simplifying things. Equally, the responses are different as well. There's not one kind of uniform way, and that's kind of backed up. Shelter and CIH Scotland and National Trade Union Conference of all kind of national bodies have all declared a housing emergency, but no indication that the Scottish Government will declare that. In fact, the Minister was very clear that there would be no funding attached to it. There would be no real response from Scottish Government. But that's all context. Coming back to in the next slide, the link to why we're here today. I think RRTPs were, sorry, just wait for that slide to move on. I think RRTPs were a good conduit. I remember Seek, Keep and Treat. I'm also a member of Fife's ADP. I remember speaking to Elizabeth a lot about kind of just the synergies in the language between RRTP and Seek, Keep and Treat and all the rest of it, about kind of dynamic growth, transformation, all that kind of stuff. So what RRTPs in my view did was promote a growth in housing first as a kind of wraparound, tolerant, elastic support kind of model. I won't go through housing first. There's far more better placed people to talk about housing first than me, but it really took a kind of pathfinder programme and tried to make it mainstream. I think what they did do in the research programme that CIH, Ashley and I laid out across the local authorities was most local authorities said that the actually generated approach, there wasn't a consistent engagement with health and social care, children's services and other services, but there was a lot starting to generate in terms of collaboration, but it was patchy, it was localised, it was short term, I've used the broad term test to change because that's why I apply in Fife if you don't really know what you're doing. I think the term pilot or phased introduction got kind of replaced with test to change in Fife. But there seemed to be quite a lot of that happening across Scotland that all tended to be either partly funded, fully funded, or in other ways resourced by the RRT development. And that was targeted at maybe people with alcohol and addiction problem, people with criminality, people with other things other than a housing issue to deal with. So lots of kind of optimism for change and things actually happening, a bit of momentum kind of growing over the 5 years. But you will hear me talking about RRTPs as a journey rather than a plan and a strategy. That was always Marion Gibb, or the late Marion Gibb's advice to me. Don't see this as something you can do in 5 years. Use the 5 years as your kind of platform to then move on to the next stop. Sorry, I'm not picking up all the questions, but RRTPs, just in case you missed it, are rapid rehousing transition plans. They were underpinned by Scottish Government guidance produced by Indigo House, and they were something that all statutory homeless authorities were asked to produce back in 2018. We got about 6 months to write them, so not a long period to write a detailed and comprehensive strategy, and they've probably grown organically. All 32 local authorities have developed them, but they all look a little bit different. Well, they kind of started in guidance. Each local authority developed them to meet their own housing, homelessness and wider sector content. So there's not one template, and equally there's not one measurement framework for them either. It's kind of been measured in different ways with local authorities doing different things. But some of the common themes are things like the emergency housing first and various other bits and pieces. So apologies if I'm missing questions or if I've covered that before, because I think I did say a little bit about RRTPs earlier on. Where I think we are now is that there are a number of kind of known groups more at risk of homelessness, and a lot of kind of emphasis on things like No Wrong Door. I know Homeless Network Scotland have got their own kind of brand of what No Wrong Door is, but I'm seeing that kind of grown locally in different ways. We've now got a homeless prevention or a kind of public sector homeless prevention book on the statutory books. I'm not sure it'll be an early introduction of that legislation, but it should start local areas talking about what health services, what ADPs, what schools and what others can do to prevent homelessness within their own resources. It contains something called Ask and Act, and it takes the prevention of homelessness out to 6 months rather than 56 days as it is just now. It could be really positive if authorities do try and get in earlier, spot the signs, engage in collaborative working. If it becomes a mechanism to refer to people to homelessness services, then the system's going to flood and the system's going to break even in a bigger way than it does just now. I think the other thing that's happened over the last number of years is that there's been some real questions around how local authorities, particularly that's the perspective I take in it, are actually working with partners, how they're commissioning services, and how they are developing links at those kind of priority groups that I've talked about. Again, 32 local authorities doing 33 things differently, or slightly differently anyway. It's how you can pull that together, and that's where I think MAT standards could help. Although definitely the two that you're talking about today, 3 and 8, I'm kind of intimately involved with in Fife, and we haven't got any answers yet. I just need to be honest about that. Just moving on to kind of get away from the national and how things are in Fife. That's my you're running out of time warning coming on just now. So it's really difficult. I've doubled temporary accommodation. It's not enough. We've moved through a whole staff redesign, real working to support people, and it is around how we get collaborative working case management. Still issues there. Housing first, all those things that I've talked about before are going up, but the challenge around this screen this morning will be thinking that increase in homelessness is probably also proportionate increase of people with drug and alcohol problems and other things. So how do we respond to that? There's some silent stuff in there. There's lots of people that are not recorded formally in the system, so that people that are sitting in hotels and hosted accommodation, and that could hit the homelessness system. Well, they started different things for different ways. But how do we? The challenge for discussion here is how do we get to the way? I know, see Brian appearing on the screen. Dundee have got a good integrated way of working with health and social care, but how do we develop pathways for people who are experiencing real challenges around this and need holistic responses. The final slide, I'm happy to give up, Steph, because I know you need to make time up, but it was just some kind of final thoughts. Are we on a track, or is it still a journey? I think there is time, but how do we support the really good areas of practice that are happening just now and mainstream them? How do we twin track a need to meet statutory duty with transformational change in all parts of the programme? And how can others help to increase housing supply? Housing and homelessness services are resilient, but that's why I wanted to come along today, because I think there's a lot of heads and a lot of thought that could go into this, but how can we improve that integration between housing, homelessness and other parts of the system that need to wrap around people, particularly vulnerable people, to make their life outcomes a little bit easier and better. Sorry, I am over time, but I'll stop there.
Not at all. You're all right, because I know how challenging it was potentially going to be to get you to wrap all this up in 15 minutes with such a broad subject. But that was really helpful and insightful to hear more about it, and like that appetite to engage with the wider system on how we can support people that are with complex needs and that are vulnerable on that. I do have a couple of questions in the chat. So first one is from Jacqueline Smith, who's asking around if local authorities were allocated a proportion of RRTP funding, or did each of them have the opportunity to ask for like a specific amount?
Yes, all the RRTPs included a resource sharing element. I think it's probably fair to say that everybody asked for a lot more than they actually got. I think Fife's RRTP was costed about £3.1 million per year, and we got about £500,000. And I think that's probably proportionately across the piece. So they were written very quickly. They were written, I think, by people who knew what the system was and knew what needed. So they've been refined over the years, but I don't think any of it. So this is not a dig at Scottish Government. It could be perceived as one, but I don't think, even though the £50 million of funding was there, it's been recycled by Scottish Government in different ways, and different cost apportionment mechanisms have been used. But it's been generally convinced. But the answer to the question is, I think local authorities gave the best information they could, but they didn't get what they needed at the time.
Great, thank you. And then I've got another couple, one from Alison Crockett, asking around if there's other high tolerance, low tolerance threshold models in Scotland, apart from the Simon community. Sorry, stumbling over my words here.
I think there's lots of different models. I think I didn't have time to cover all the different stuff, but I think local authorities have found different ways. So Housing First is a kind of very kind of integrity to the model kind of way of working. It is about wraparound support, and it's about all the rest of it, but there's a lot of issues that we're working with. And in Fife, we're working with Turning Point Scotland. I know we've got some reps from TPS, but we're developing not just Housing First, but a whole systems approach to homelessness. And we've developed a kind of outreach, and it's what I'd call an assertive outreach, which is a locally grown thing. We developed different models, Hunter House in Kirkcaldy. I think a lot of that was happening across local authorities. They were developing different things and different ways of working, different ways of commissioning. So that's why it's quite difficult. The task and finish group that Maggie's about to publish does look at supported accommodation and accommodation with support, and highlights a number of different issues, but it's so different across the country. While most are England pressures, there's Perth and Kinross. I don't know if there's Perth and Kinross representation on the call, but Perth and Kinross well notified in Housing World for being the most progressive in terms of rapid rehousing, and further down the track than most. But I don't think there's another national model. Housing First is the only one I could really think of, but there's lots of good practice with local authorities working with their partners in health and social care and with ADPs. They'll all be called something different. The issue is that they've all still got initiative focus and they're all still short term. So if RRTP funding goes or other things happen, then there's a high probability a lot of the good work that's happened over the last 5 years may well be lost off a cliff edge.
No, that's great. Thank you for that. I'll take one more. There's a couple more questions came through, but I'll take one more just in terms of what working through my list sort of thing. So the one that we can squeeze in probably is from Sarah McLeod around if there's no temporary accommodation available, what then happens to the person who's experiencing homelessness, basically.
There's not really a lot to. I think we will see an increase in rough sleeping that's been reported. In my area, it's not because there isn't. It's because we've run out of everything. We've got 1,200 scatter flats in operation. We've got every hotel and B&B that will take us. Every others is not. So there really is limited options for people. We've got, as I said, a private sector that's fairly narrow. That's not the same in all local authority areas. There'll be others that are represented here that can say, actually, no. If I'm Aberdeenshire, I'm going to say, actually, that's not my context. My context is a different type of pressure. But it is really natural for housing officers. They hate it. It's really doing their mental health a lot of harm at the moment. Having to say to people, look, I'm really sorry, there is nothing we can do. That said, in Fife, I don't think there's a huge cause for rough sleeping. I think a lot of people have got places they can go, but in this context, I think there's a lot of people. The kind of impression is that everybody that applies as homeless has got something. No, not true. 86% of people that apply to my authority as homeless do not have another issue. They don't have any other support needs. It's kind of 11%, 5% and 6% up a kind of spectrum of needs. The issue I think we've got is that core that will have homelessness, drug and alcohol, criminality and all the rest of it. There's about 400-ish in Fife, 40 odd in the homelessness system. Who continue to hit doors. For them, sometimes the problem is that we don't have anything. It's like we've exhausted everything. We've given them 12 different types of accommodation, but nowhere else. They're now known by reputation. So that's why we've had to grow a set of outreach services. I'd hate to think we get back and we got rid of a lot of the night shelters and stuff like that across Scotland, but I can see that looming again somewhere down the track. Particularly in the big cities. I expect to see that map of red grow quite strongly over the central belt. So it isn't just a Fife issue, it is a central belt. But the blunt answer to the question is housing officers are having to say to people, I'm sorry, there's nothing I can do in Fife and elsewhere.
Great. Well, thank you for that. And I say there is, I think, one or two more questions in the chat. So if you do get a chance to sort of respond to them, but if not, we can pick them up laterally as well and send out a written Q&A and whatnot. But I'll move on to the next speaker just so for times and whatnot. So moving on to our next speaker, I'm welcoming Anthony Morrow from Sanctuary Scotland, and he's going to share a bit around what they're doing with community connectors and housing and the impact this is having, and again the links to the MAT standards. As before, please do utilise your chat function, and as I say, hopefully we'll get a wee chance to pick up some questions at the end as well. So Anthony, I will pass over to yourself.
Thank you very much. Just check that you can hear us. All right, Stephanie?
Yep, I can hear you. Thank you.
Right. Champion, great. Thanks very much for your time, everyone. I really appreciate the opportunity to speak to you here. So I'm Anthony Morrow. I manage the community development work for Sanctuary Scotland. I don't have a housing background, but I've been with Sanctuary for about 9 years now. My background was kind of youth work and community development and stuff like that before I came into Sanctuary. If you could move on to the next slide, please. So this is a question that I've been asking more and more internally, because coming into housing from outside, I was finding that there was a view that housing was kind of the end point, that if we got somebody into a safe home, then that was almost like the job done, and then we can move on to work with the next person. But through the work that we've done over the past few years, I've been trying to refocus us on thinking about safe home as the starting point. Like that's where our work really begins. So getting somebody into a home and helping them feel safe, that's not the end point for us. That's actually, not the easiest bit, but it's actually where the real work starts to happen, I think. Moving on. And this really is the crux of what it is that we try to do. So I'll tell you a little bit about some of the work that we've been doing and how it's developed over the previous 3 to 4 years. But this was the main aim of it. Like I was interested in thinking about how we could have a more proactive response to not just keeping people in their homes, but starting to help them have a good life. Like I'll be very honest and open about it. Like I had a bit of a bee in my bonnet about the fact that as a housing provider, we carried out evictions. But it wasn't enough for me to think about stopping those evictions. We had to help people feel like they belonged somewhere, belonged in a safe home, belonged as part of a community, and could start to build a good life. Because I fundamentally believe that a safe home that you can call your own is the foundation to having a good life. And I'll talk a wee bit more about how we've been doing some of that stuff. If you move on to the next slide, please. A little bit of context. So Sanctuary is quite a big housing registered social landlord in Scotland. We've got around about 11,500 homes spread across various different local authorities that are noted there. As I say, I was interested in how we could take a community development approach to tackling some of the issues that I was seeing in housing, and thinking like just a different viewpoint and a different approach, how that might change some of the responses that we had. So it was really just about looking at things a little bit differently than just having housing solutions to housing issues. And that is what led us to the homelessness prevention work that's kind of helped us build on over the last 3 years. It was initially a reaction to, like I said, seeing evictions happening and being unhappy with our role in that. And when I spoke to my director and housing managers and stuff, they were like, yes, we think that there's something that could be done here, but we want you to try and improve it and see what we can do about that. So I was kind of given the challenge back to try and do something about it. But in that as well, like Gavin mentioned it, there's the pressures that are faced by housing management were very, very real, and sitting in alongside housing management staff, housing officers, assistant housing officers, I saw that all of the time, the difficulties that they faced and how hard they found their jobs, and I really wanted to help them do that, because there was a lot of people who really cared about making a difference, but were struggling because of the pressures that they faced. But there was, and this is the thing, that there was a will from people within the housing system to do more to try and help people. And then underneath that, it was a consideration about the ongoing costs of tenancy failure. And I don't mean that just to us as a social landlord, but like beyond the housing sector. So the onward costs to everybody else, and starting to think about, is there a more collective solution to this? And can we widen the lens and be a bit more creative about how we tackle some of this stuff? The basis for that was the shelter cost of eviction report that came out a few years ago. I don't know if people have seen that. It's really interesting. It priced the cost of an eviction in Scotland at £14,952, and that was really the direct cost. So that was the rent arrears, the void turnover, and the direct staff time. It didn't consider the ongoing cost to other partner organisations, to the wider sector as well. So I do think there's a financial case to make even within the housing sector, but if you widen that lens a little bit again, I think there's a more compelling financial case to make about this stuff. I should say the work that I do wasn't necessarily born directly out of trying to address or support the MAT standards, but that has become integral to it over time, just because of the learning, because of the type of work that we've been doing. It was really looking at housing and thinking actually quite how inhumane it can be as a system sometimes. And I mean that from the point of view of tenants, but also for staff. Like it can create quite a lot of harm for people. And this was something that I really wanted to try and address. Moving on, please. So I'm going to rattle through some stuff. If people want more information, I can talk to you another time, or I'm willing to share all of the things that we've got on this. But the direct response was really to create a role that sat in between the team that I managed, which is the community development, and the housing staff, and it sat in that gap where we were seeing people fall into all of the time. So it was about upstream prevention of homelessness. Like as a housing provider, our job, I felt, was to provide housing, not to take it away. And if people were really, really struggling to keep their tenancies, then a lot of that was on us to try and provide the right support that they needed to do that. So we created a role. I got some money from Scottish Government and RSL Homelessness Prevention Fund, and created this role, which we call the Housing and Community Connector. It used lived experience at the heart of it. So it brought in people who had experienced homelessness or eviction from the point of view of a tenant before. And that was something that we didn't necessarily have in our team. Now, I don't think lived experience is a silver bullet, but it was a skill set and an understanding that we didn't have. So I felt it was really important to bring it in. The main focus of the role is to build trusting and consistent relationships with tenants, and to advocate for them, in a way that actually challenges some housing management practice. So we've had some very difficult conversations internally about the way that things have done. And I like to challenge that, like I think it's very difficult whenever you are already struggling in life to challenge things that a service is doing to you. So we felt there was a role for us to do that from within, and to have some of those difficult conversations with housing management on behalf of the tenant. On top of that, the housing system is like, it's really hard to understand. It's very hard to navigate, and we wanted to support people to be able to do that. Over the few years that we've been doing it, what we've noticed is that addiction and associated issues are prevalent for lots and lots of people. We come up against that all of the time, be it to prescription drugs, illicit street drugs, alcohol, all sorts of different stuff. But addiction was present whenever people were really struggling. Usually for housing, or for us in our context, we saw arrears and we acted on arrears. But what I talk about now is that arrears are a symptom of something much deeper. Like I've never met anybody yet who's had the perfect life and wakes up one morning and decides they're never paying their rent again. So to me, it was on us to understand why people weren't paying their rent, not to be punitive with them for not doing that. So I saw housing chasing the money really, and not necessarily caring for the person. And I felt that if we could reframe that and try and get people to start caring about the person as the starting point, like the money will follow. If you keep people happy and healthy, then the rent will get paid. But I think if you only focus on the money, then you miss a huge part of what you can provide for people. The tenants that we were supporting, or the tenants that we continue to support in our day-to-day work, they're often incredibly isolated. They're isolated from community, sometimes from family, and often very isolated from services. They don't know what they can access, and they don't know what and they don't know what services out there. Like, so we meet people who don't even know that they can go to food banks because of their situation. So there's people who are very, very isolated from every aspect of what could give you a decent life. We support people with their housing stuff. We also try to connect them back into community. So try to get them some social connections. We make sure that they've got links to GPs and ADRS and all of this type of stuff. And more, we found multiple people who wanted to access recovery support but couldn't. They either didn't know what was there, or they wanted to they didn't know what was there, or they were told that it wasn't possible for them. So we were trying to support them with that kind of stuff. Next slide, please. I just want to give a really quick example of one of the tenancies that we're supporting. So we had a tenant who was referred from a housing officer due to the conditions of their living and concerns about their welfare. On the face of it, though, that tenant really was almost like the perfect tenant. They paid their rent, they never made any complaints or anything like that, and it was just because of a chance visit that we'd seen a deterioration in their living conditions. When we got into it, I'll come back to your question, Freya. When we got into it, what we found when we went in and supported the tenant, there was chronic addiction issues there. There was alcohol, illicit street drugs, and prescription drugs. And the tenant confessed to us that they were really, really struggling with life just generally. So we engaged with them via the welfare rights officer, and they declared to us very early on that they wanted to access rehab. So we decided that, we wanted to support them with that because that was the wish that they'd made. It took a long time to get that, and there was a lot of false starts. And during that time, it was 18 months or so, there was multiple suicide attempts. There was disconnection from other services, and we had to put in a lot of hard work to really support this tenant. Now, 18 months is a long time for anybody to be desperately trying to access what they wanted, and we were a real support for them. They've been really happy with the support that we've offered. Now, that tenant has been a success story because that tenant is now 18 months sober. They're volunteering back in their local community again, and like all the good stuff that comes from whenever they're connected back in, they're very adamant that the support that we provided in advocating for them and helping them through those hard times, and the fact that my work I brought their lived experience of similar thing, it really helped them to get through some of those dark days. And it's only one example, but it's just a little bit of context for some of the stuff that we experience as well. Next slide, please. So far, this is some of the impact that we've had. The initial role was so successful in helping tenants who were most marginalised by the current systems that we've replicated the role across Scotland. I can talk a different time about how we've funded some of that stuff, but it's a mismatch of a mix of operational funding. It's also some grant funding, and also I think one of the interesting things with housing is that we can access funding through supply chain and contractors that is investment back into communities, and I think that opens a door for accessing different types of money that we can bring in to a collective response for this stuff. We supported just under 380 tenancies to date. And when I go back to the shelter cost of eviction report of around about £15,000, that is a lot of financial saving that we're making. Now, I'm not daft enough to think that we would claim all of that as our work because there's lots of contributors to it, but it is a substantial amount of impact that we've had. we identify tenancies that are at risk due to addiction, and we try to get them the access and support that they need. There's all sorts of partners and referrals and everybody that's involved in this. But what we find is that connection back into community is really, really key. We don't create a dependence on the workers that we have. We really have to try and connect people back into the community to be part of somewhere where they live. There has been lots of interest from other RSLs, and I've spoken at housing conferences and various other things about this model. Like there is a will from other housing providers to try and take this type of approach. Next slide, please. Really brief, I just wanted to share, this is some of the feedback that we've got from tenants about the impact that it's had for them, that the housing provider has invested in trying to help them have a better life. And then the next slide. And also for staff, I'm not going to go through all of these, but it's just, it's had a very real impact for staff. It's helped them deal with some of the stuff that Gavin said, the mental health pressure of not being able to help people when you came into this to care, because caring is very hard sometimes. So being able to help people to a better destination or just to have a slightly better life, it works both ways. It's about making sure that staff are equipped to have better lives as well. And then on the next one, I've only got a few slides left, Stephanie. Some of the links to the MAT standards. So like I said, we didn't initially set out to do this, but these are the things that where we see the overlap, and from conversation with other people who are more well versed in this type of world than me, we've been hitting some of the MAT standards, and especially there because of what we're talking about today, MAT 3 and MAT 8. And I think really importantly, like in terms of MAT 8, keeping people in their homes is a must. Like your recovery is reliant on feeling safe and secure and being able to have a place to build out from, a place of safety, both physical and psychological. And that's where we've started to concentrate a lot of the work that we do. The next one. I just want to talk really quickly about a potential pilot. So this is part of what I was wanting to do, is have a wider conversation about, could housing be more at the center of this type of response? Like there is a clear link between addiction issues and tenancy failure. And then again, going back to that cost of eviction report, can housing be more at the center of a response to helping people? Like, I don't have the answer to this, but there was one pilot that Stevie Wishart, who's on here today, and I had written, because we thought about the fact that housing can access money as charities that other services can't. So can we put housing at the centre of potentially supporting people to get into the recovery pathway of choice? We've got a project outlined. We are currently looking for funding for it, but the idea would be that the team that I have offers pre and post intervention support, and we make sure that people get all of the support that they need to maintain their home before and after. But we're looking for funding that can be directed into the recovery supports that people want. So better connection and collective working around this intervention. And I think, again, widening that lens, that sense that there's savings to multiple sectors, we believe, and that's why we're looking for buy-in from other people. We think that this could make a massive difference if we put housing in the middle of supporting people to access recovery, rather than it just being an alongside thing. And I think that there is definitely a will from housing to work in that way. And then last slide, or last two slides, not much on them. So the main learning for us was that housing is really well placed for early intervention. That I think a home you feel safe in is absolutely integral to recovery. And I think more and more we need to challenge housing to do that, and to challenge housing to step up to be part of somebody's recovery journey. Connection back into community is absolutely vital for people, and trust and relationships are key. I think one of the main things that we've learned is that people tell themselves the stories, and the story you tell yourself about yourself, that shapes your behavior. And what we've found is by interacting with people and offering support rather than being punitive initially as a housing, it can change people's minds, it can change people's thoughts about themselves, and that is a really crucial thing that we can offer. And generally, like I always say this, like, these are huge collective issues that we face. So I think it requires a collective response, and I think housing can do more. And from my experience, there is definitely a will to do more. And then the last slide. I'm not asking these questions to you, but these are the questions that I'm kind of generally asking. So I would be interested in what people think about these. I'm not looking for it now, but do you think housing can play a bigger role in contributing to any of the MAT standards and contributing to people having, a better chance at recovery? Is there anything you can do to support that? And if that was to happen, what needs to happen next? Because we are still in the infancy of doing this. I would absolutely love to speak to more people, because I think housing has genuinely transformational potential for society, and I think it's untapped at the moment. And I would love to meet and speak to more people who are also up for trying to do some of that stuff.
Great. Thank you so much, Anthony, for that. As there's a few comments and questions in the chat, but I'm just conscious of time, so I'll not go through them at this point. But if you get a chance to have a wee look at them and respond to them, that would be brilliant for us. But if not, we can pick them up post-session and make sure that that's circulated with everyone. But my feeling is that also there is appetite there in terms of that housing contribution and how people can work more collaboratively on that. So really helpful to hear your kind of insights and experience of that to date. As I say, we're going to take a short break at the moment, so we'll come back at 12 o'clock. There is going to be another wee question that's going to pop up on your screen just to contribute any thoughts about what you would like to see at future webinars. We're in the process of planning out the final, the next sort of few webinars and the topics on them. So just if there's anything specifically that you would like to see in an upcoming webinar, if you could pop that into the poll, that would be appreciated. And as I say, we'll resume at 12 o'clock. So please do take the opportunity to get a wee screen break if you can. Thank you. Welcome back, everyone. Hopefully you all had a good chance to get a wee bit of a screen break and a wee bit of a refreshment as well. Thank you, as I say, to Gavin and Anthony so far for the presentations this morning, and we'll move on to our final speakers of the session. Again, please do, I see the chat's generating some useful conversations, so please continue to engage with that as we go. And I'll hand over now to our final speakers. So Cheryl from Places for People, Carmen from Turning Point Scotland, and Martin from Police Scotland. So over to you.
Thanks, Stephanie. Hi, everyone. My name's Cheryl Neill. I'm the Housing Manager for Places for People Scotland. If we can just move to the next slide. Okay, so to give some background, Places for People Scotland are the UK's leading social enterprise. We manage over 9,000 properties across Scotland, and we're a fundamental provider of social housing in the northeast of Edinburgh, where this project operates. What we found was that we had an increase in the number of complaints of antisocial behaviour, non-engagement from customers, and people at risk of drug-related deaths. So as an alternative, obviously we don't want to evict vulnerable customers and put them back into a system of homelessness. We looked at a proactive initiative to help and support customers with extensive support needs. And this is where we launched our first partnership of its kind. It's a collaboration of stakeholders involving Police Scotland, NHS Lothian, Edinburgh Drug and Alcohol Partnership, the City of Edinburgh Council, and Turning Point, and that also includes social work as well. So we launched the initiative, which aligns with the MAT standards 3 and 8 around proactively identifying and offering support and advocacy and support for housing. Next slide, please. So the partnership works by reaching individuals with drug issues who historically may not have been able to engage with services due to the complexity of their needs. We were finding that the housing officers were going out each week and visiting the same addresses, weren't being able to give them the full support that they needed, because obviously they have a generic role of supporting the rest of the customers in their patch. So we established the outreach worker role, and that can often be the first prompt for customers to engage with services. They're able to deliver the service directly to them, knock at their door, give them calls, texts, etc., which again the housing officer wasn't able to do. So the role also facilitates reconnection with the housing officers, assisting them to address tenancy issues that may put their tenancy in jeopardy. So the outreach workers able to have those separate conversations, so it builds a better relationship with the housing officer. Since introducing the role, we've supported in excess of 25 customers through their ongoing journey back into recovery, and able to sustain their tenancy. How the project works is the outreach worker can assist them to point them in the direction of appropriate services with prescriptions, any sort of tenancy related issues and financial issues, and they can provide targeted support. So it could be something as simple as they need a bus pass in order to be able to get to appointments. They're able to dedicate that time and take them to appointments to make sure that is facilitated. As a result of the work that we're doing, we've had an increase in the amount of tenancies that have been sustained. It's obviously strengthened communities and improved relationships between agencies and services. We've also had a reduction in the amount of antisocial behaviour and criminality and the amount of tenancy enforcement that we've had to take with these customers. Next slide, please. Some of the feedback that we have had from some of the service users, as you can see in this text here, that their life was on a downward spiral and they were always getting in trouble, and as a result of the outreach worker engaging with them, they've been stabilised, put on prescription and not using illicit drugs. Next slide, please. And this is further feedback saying the Lighthouse Sorka always answers the phone when they call or text, and she can check up on them. They really see the value in the fact that they've got somebody that they can reach out to, and they can sort of facilitate any issues between housing with their outreach worker, and also the fact that they're able to just keep turning up at the door, doing unannounced visits just to check in with them and just really check on their welfare has made such a significant difference to the work that we've been doing. Carmen and Martin, I don't know if you want to come in with anything.
Yeah, just there's something in the chat just about harm reduction. It's very much a harm reduction approach. Quite a few of these individuals were either had dropped off prescribing as well, so we were able to offer take-home naloxone. We were able to help them access treatment if that was what they wanted to do. So harm reduction was definitely a big part of this as well. We were able to offer fuel vouchers, food bank vouchers, and as I say, we were able to give them a bus pass so they can get to appointments. A lot of it was about the relationship with the individual and where they were at and what they were wanting to achieve as well. If people were interested in accessing rehab, that was also an option. So it was very much harm reduction and recovery focused. It was very much depending on what the client's aspirations were as well. I just want to be quite clear about that. So we were also able to offer BBV testing as well, just to make folks aware of that as well.
I don't know if you want me, Cheryl, just to say I'm Martin Wood from the police. I'm part of the community team. When we are part of, my role is to look at safeguarding and harm reduction and the reduction of antisocial behaviour in the area. So I engage with the wider services as well, but obviously Cheryl and her team and Carmen. The work that they are doing is really hugely beneficial in the area. We get, as the police, we tend to be the point of contact for a lot of the antisocial behaviour which can be caused. And as Cheryl says, some of the housing officers, and it's not really their remit, or it's difficult for them to manage. So having a facility of outreach workers which are going out and actually tackling and assisting the tenants with the issues that they're having it is having a significant benefit. We can see it in the reductions in the calls we receive to specific areas, and it does have a hugely beneficial, not just on the people with the housing, but on their lifestyle impact, the lack of tenancy action, and just being able to be comfortable in their houses. You don't want to be coming into contact with the police. Frankly, that's a good thing. We don't want to be doing it either. And frankly, if they're getting the support and help from outreach workers and housing, it's been hugely beneficial. So it's just really to say with how much we value the work that's been done by Cheryl and our team.
Great, that's been really helpful, and it was good for us to tour of what you're kind of doing in that area. I don't know if there's any more. Oh, here we go. So from Jim, is the outreach support service project a resource funded, and can you allow it to be there longer term?
It complements our existing assertive outreach, but obviously Places for People have funded that post partly with ADP, so it's been joint funding, which is probably our only post, which is partly funded by ADP and Places for People. It's been running now, this is the second, getting into the third year. So at the moment, hopefully, yes, we currently have, I have another assertive outreach worker who focuses on hospital discharges, ambulance referrals, non-fatal overdose as well, but they work quite closely together and will team up to do first visits to tenancies as well. So I'm hoping that it will be there longer term, just to answer that question.
That's great. Is there anything else? Because we do obviously have a bit of time here, sort of things. So is there anything further you want to share about the sort of service, or just any sort of challenges, or how it is linking into other services sort of locally? Obviously, Martin, you were saying around how the impact that's having within Police Scotland in the area, you know, and the benefit of that collaborative working. So just, yeah, is there anything else you'd like to kind of expand on in relation to that sort of collaborative working in different organisations that you're working alongside?
As I'm part of the local multi-agency vulnerable adult group, which is shared with social work, health, Turning Point and NHS, and we hold that under adult protection guidelines, and where any of the partners, including police, if we're aware of people who are escalating concerns around their behaviour, about their lifestyle, who may have benefit from other agencies being able to help. The aim of it is about reducing drugs death and helping people get into recovery that may need it or having a difficult time. And it's about sharing that information through that system. And obviously we do that as part of, as Carmen said, that's through the wider aspects, which this project falls into that. So it's linked to Places for People, but they have a very large footprint in this area, which is linked to, there's a lot of community issues in the area, I think it's fair to say, social mobility issues, deprivation, you know, it has some issues in there. So it all just feeds in that we can actually start sharing. It's a great facility for us to have. It does reduce our contact with people unnecessarily, and it's getting people the correct level of support and help that they need in the community. And it's getting it to the right people to do the right work rather than filling in the blanks.
Just to say, I've noticed another question there about people being liberated from prisons, and within Lothian, certainly that comes under the CGL, which is Change, Grow, Live, offer that support, but obviously we work alongside them as well.
Great. And there's another one coming just there from Freya. Carmen, I don't know if you can see that one. The voluntary through care grant fund is now live and thinking about making the strong links between individuals and housing for this being transition from prison back to community. So it's that, again, that one link to support for people being liberated from prison and whatnot.
I think that's really important, and as I say, for the Edinburgh area, that would be sort of Change, Grow, Live are part of that, and that's part of what they do. But again, we work closely together as well, and certainly if that is impacting any of the Places for People clients that we're funded to target with this particular post, then that is something that we would do. But the issues probably are just there's huge issues with housing for anyone getting out of prison, unfortunately, and I don't think that's just Edinburgh that's declared a housing emergency as well. So there's still an awful lot of work to be done in regards to that as well.
Thank you, very helpful insights. I don't know, is there any other questions sort of we want to cover? We've got a couple of minutes that we can concentrate on, but if not, I can bring us to a wee bit of an earlier close, which is always nice on a Tuesday afternoon. And that's helpful. Thank you, Freya, as well, for popping that information in the chat as well for people to have engaged with if need be. So yeah, is there anyone else that would like this? So feel free to pop a hand up or pop your mic on and ask any questions while we've got the speakers. Anthony and Gavin are still on the call as well, if there's anything further for them. Oh, Ruth, here she comes. Hi, Ruth.
Hi, folks. I was just really interested in understanding a little bit more about information sharing across all those partners. I'm really thoughtful about the kind of safeguarding components and the kind of public protection arrangements, but I just wondered if you could share with us how you've overcome some of that, because a lot of the feedback that we hear about local services are trying to do quite kind of complex integrated care. I just wondered if you could share with me how you've overcome that and what arrangements or structures you have in place locally to facilitate sharing information.
So not sure who's that was directed at.
Any who's
Anybody?
any of you? Any of you?
Sorry.
I think it comes under a lot of escalating concerns. In some cases, people do hit the 3 points of the adult support and protection, but also it's very much led by the client as well. Very often the police are maybe have been involved with the client, and if the person's had contact, we speak to the client first and ask if this is something that they want, and they will give their permission for our assertive outreach to contact them. So that would just be a telephone number if they happen to have that, or permission to come in and go to their address as well. So it has to be quite dynamic, but I mean, it is very much involving the client at the centre of it, asking them if they would like the support, if their discussion is with a housing officer, would they like Turning Point to get in touch with them? They don't have to come to the building, would they like Turning Point to do that? Cheryl will then make the referral, and then we will reach out and contact them as quickly as possible as well. But it's very much going back to what go back and having that conversation with the client. In most cases, they'll give their verbal consent if they know there's extra support there. They're in desperate circumstances. They're more than happy to at least speak to us on the phone or have us come to the doorstep, have a chat with them initially, or meet them in a place where they feel safe. Sometimes it could be quite intrusive to turn up at someone's house, so we will ask them where they want to meet. So sometimes that can be a cafe or somewhere initially, but obviously, for limits of confidentiality, we won't go into it. It will just be a first meeting, and then suggest maybe after that would they like to meet elsewhere, or it might be quite a few telephone conversations in the beginning till the person is comfortable to meet with us as well. But usually when they find out what we can offer, the bus pass, treatment bus pass, I appreciate not in other local authorities that isn't always available, but for us is a real good carrot. It's a real good, it's something great that we can offer. We can offer a phone, we can offer a SIM card as well, so people can see that we're trying to help. We've been able to access tablets through other partners, just whatever helps them keep in touch, and for us to keep in touch with them as well. And it sometimes can be a slow process as well from that point of view, but it's very much keeping the client at the heart of everything, asking them and just letting them know what support's available. It's an informal chat at the beginning. They're not going to be forced or pushed down one direction or the other, and certainly taking that harm reduction approach is really important as well. We're not there to judge what people are using, and very often in some cases, some of the people have been referred have actually been relatively stable as far as their drug and alcohol use might be from that point of view, but they're just facing lots of other really difficult issues with gatekeeping, domestic violence, issues with people coming to their tenancy or whatever as well.
Okay, thank you so much, Martin. Do you ever get anything to add? I'm just thoughtful about, obviously, a lot of soft intelligence that you'll gather, but how does that work for you in terms of your role?
In relation to information sharing, there's information sharing protocols between police, health, social work, etc. And there's also between places for people, and Police Scotland we have information sharing agreements as with the landlord. If, for instance, if I had concerns about if Cheryl's tenants, it would be because that information has been recorded as an incident on the police system, and it would be there's been an issue there, and so as standard, if we would let them know that there's been an issue as part of the information sharing that address. We're not telling, we don't tell Cheryl how to deal with it. Cheryl or Carmen would then decide if it's what that issue is, or how they need to best to progress it. But we also have, as I said, we also discuss it through the multi-agency vulnerable adult group, which is the wider group, which has the specific information sharing for safeguarding and adult support and protection under that premise. So we would share information with that group. But as Carmen says, generally when vulnerable people come into contact with the police, we will seek their permission to share information with partner agencies, and that tends to that would be recorded on our vulnerable persons database. So they should be, ideally we'd want that, unless there was a serious significant risk where we would try to override that rule, but we don't. That's not very often.
Sure. Thank you so much, Steph, and thanks guys for that. That was really helpful. Thank you.
Great, thank you for that. And yeah, the data sharing and you're getting the information to the right people. It does often come up as a challenge, working in this sort of context, but also the wider sort of health and care context as well. Is often a bit of a barrier. So it's good to see that you've got those kind of agreements in place and that it doesn't seem to be, causing any delays or challenges with the work you're doing. So that's fantastic. I don't think there's anything. Oh, Jim was just sharing something around that they do an opt-out one, so that's a helpful insight as well. So it's great just to hear about what other areas are doing and how could it potentially be utilised in some areas that maybe are having more challenges. But I don't think there's any more questions at this moment in time. But obviously, if there is anything, the people that are attending can obviously reach out to our speakers or contact ourselves at the his.mat email address, and we can put you in touch as well. Do you know what I mean? If there's anything you want to pick up in relation to further questions or conversations at all, please do that. So just left me to sort of bring the session to a close this morning, well, now this afternoon. I say again, thank you to all of our speakers today. It's been really helpful having such a wide variety of people from different areas and organisations and working on this to kind of get to a collaborative aim. And thank you as well to obviously all our attendees for coming in and participating with the session, with the chat and everything as well, with the polls as well. The slides and the summary of today's session will all be shared on the website following today's session, and as I say, there'll be the recording as well, so please feel free to share that with your networks to anyone who may be interested with that, just in case there's people that couldn't obviously attend on the day. I just wanted to pick up as well that some of you will be aware our pharmacy clinical lead, Adrian McKenzie, has been leading on a piece of work to understand the impact and implications of the delivery of MAT standards in community pharmacy. And we're very delighted to be saying that the findings of this are being published today, and there'll be a link that will go into the chat with for you now to have a look at your leisure. There is an executive summary within that, so even if it is just a case of you engage with a shorter piece, then that's absolutely fine, but it does give some insights into that potential for the delivery of the standards within community pharmacy. So as they just engage with the findings of the report, and again, share it with your networks as appropriate. If you do wish to sort of speak to discuss the content any further or reach out to Adrian, you can get him on the his.mat@nhs.scot email address, which I can't see apparently today. And I say Adrian, I'm sure will be delighted to kind of come along and have a chat with you in relation to that, the findings of that. Due to the kind of publication of this and the importance of community pharmacy as a partner within the MAT standards, our next webinar is going to be focusing on that. So that's planned for the 18th of June, and the invite and registration link will be out in due course on this. And finally, just the final ask for today, lots of asks, is that there is a couple of final poll questions just to come through in relation to the session, just to help us to continually develop and refine the future sessions. So please do take a moment to do that as well. And as I say, please do continue to connect with us on X through the iHub website as well for the MAT Standards website and via email. And if there is anything that you guys are doing in your own local area you think could be helpful to kind of contribute, as I say, as a webinar or a case study or anything like that, just about sharing that good practice and learning that's happening out in the system, please do get in contact with us and we can discuss how do we best facilitate sort of sharing that learning across all the different areas. So yeah, thank you again for your time and attention today, and please do enjoy the rest of your day and your week. Thank you.